hygiene, 20 seconds. Hello, my name is Jonathan. I'll be the nurse for today. This must be baby Andrew, correct? Okay, perfect. So what I'm going to be doing is the newborn assessments. I'll be explaining everything as I'm doing it. So I was looking at your baby's chart, and his APGAR score at 1 minute was 8, and his score at 5 minutes was a 9, which is very good. He was born at 39 weeks gestation, which is considered a term baby. So next, what I'm going to do is I'm going to listen for his heart and lungs, and I'm going to take some vital signs. Hey, baby Andrew. Right now, he's currently sleeping. I'll make sure I listen for a full minute. Okay, so his lung sounds were clear bilaterally, and his heart, I heard no murmurs, and I did hear a good heartbeat. His heart rate was 120, which is normal for a newborn. His respiratory rate was 38. I did hear some bowel sounds. Good. Next, what I'm going to do is I'm going to check his temperature. As I'm taking his temperature, I'm going to assess his head, and I'm going to look at his skin. Okay, I see his head, his ears are equal, bilateral. I'm looking at the location. Good. I'm looking at the nose. I see it's patent. I'm looking at the ears, no drainage, it's patent. I'm going to take a view at the fontanelle, which is flat. It's not sunken or bulging. I do notice some lunigo on the skin. He has good skin color. I notice no acrocyanosis. It's okay. Got his temperature. His temperature is 36.6, which is very normal. Now I'm going to go ahead and assess the face again. I see no swelling, no bruising, no edema. Same with the extremities, no bruising or edema. I'm counting the fingers. I count 5 on this one, 5 toes. Okay, perfect. I'm looking at the chest. It's symmetrical. Same with the abdomen. I'm looking at the umbilicus. It seems good. Gonna look at the clavicle. Feels good. He has good muscle tone. Abdomen, I already checked that. Now I'm going to look at his spine. Okay. I'm gonna hold him, holding his neck. Okay, I'm looking down the spine. Good. I see no dimples by the sacral area. I see no bruising, no redness. Perfect. I'm gonna take a feel for the posterior fontanelle. Good. Gonna place him back. Now what I'm going to do next is I'm going to look at the genitalia. Gonna look at the urethra. Gonna lift up. His anus, it's patent. When was the last time you changed his diaper? Oh, just a few minutes ago. What color was it? Green? Yeah, that's meconium. No need to worry about it. It's completely normal. How often are you breastfeeding him? Okay, yeah, it's important to feed him as needed. You know, babies are growing and they're gonna grow very fast, and you should breastfeed him as needed. He's sleeping. Is he sleeping okay? Okay, good. Some education about sleeping is, yeah, you want to make sure that he is not surrounded by any pillows or blankets or anything that could suffocate him, right? Okay, so next what I'm going to do is I'm going to check his reflexes. These reflexes are called primitive reflexes. So I'm going to check the Moro reflex, which is also known as the startle reflex. I'm going to put his hands up, right? And then he's gonna drop down. It should make like a C with his hands. And this reflex should go away by 4 months. Next, I'm going to check his Babinski reflex, which you basically just stroke on the lateral side of the sole, and you should see his toes fanning out. Basically, you want to make a upside down U. Okay, and this reflex should go away by 12 months. Now we're gonna check his grasp reflex, and if you put your finger right here, he should grasp it, and he's gonna hold on tight, and this reflex should go away by 4 to 6 months. Now we're going to check his, before we check his Moro, his root, I'm going to throw away my gloves. Hand hygiene again and put on some new gloves. So for this reflex, we basically just stroke the side of his cheek, and he's going to turn his head to that direction, basically looking for a nipple with his mouth. And as I'm doing that, I'm going to put my clean glove in his mouth, and I'm going to check the platelet. After that, we're going to check for the tonic neck reflex, which is basically, okay, I'm looking for the platelet. Okay, perfect. I feel it. I feel his tongue. Perfect. Now the last reflex is the fencing reflex, which is, he's basically gonna go with, it's also known as the fencing reflex, so if you can imagine, it's like this, right? Okay, everything seems to be good. I will be back with measuring tape, because we're going to measure his head circumference and his chest circumference. I see you put the diaper over there. I'm going to knead it, and I'm going to weigh it and then chart everything. Is there any comments, questions, and concerns you would like to ask me? No? Okay, perfect. Thank you. I'm going to wrap him up.